Good afternoon, Gary Pace, County Public Health Officer for Lake County, and we're going to do the coronavirus update. It's February 11th, and so overall, we're doing quite well now. The case rates are improving. The hospitalizations and death rates are dropping down locally and statewide. We'll have Sarah show the data and give an update, and then I'll come back and talk about the vaccines and a few other things.
So here's our epi briefing for February 11th. Like Dr. Pace said, we continue to see positive trends statewide. Here on the left, we're looking at the number of new COVID tests reported in the state. Testing remains high, though it has come down in the last couple weeks. On the right, we see the decrease in testing positivity statewide down to 5.5%. It was about 15% a couple weeks ago. We continue to see the dramatic decline in new cases statewide. About 8,400 new cases were reported yesterday. We continue to see declines in the number of hospitalized patients, about 11,500 COVID hospitalized patients yesterday in the state. And correspondingly see the decline in the number of ICU COVID hospitalized patients down to about 3,100 people hospitalized in the ICU yesterday. The number of new deaths did increase fairly rapidly over the last couple of weeks, but that is starting to slow. In the state of California, we have about 45,000 total COVID deaths. In Lake County, we remain in the purple tier, which indicates widespread transmission in the county. The daily case rate for January 24th to the 30th was 18 per 100,000, which was down slightly from the week prior, and a testing positivity of 6.8%, similar to the week prior. Most counties in the state remain in the purple tier. Here, we're looking at the number of new cases identified in the last 7 days. About 95 new cases were identified. This is down. Lake County has nearly 3,000 total cases to date, and we have had 2 more COVID deaths in the last 7 days. And lastly, just a quick vaccine update. As of yesterday, about 8,100 residents in Lake County have received at least 1 dose. This is 12% of the county population and about 16% of the adult population in Lake County. Thank you.
Well, thank you, Sarah. And so just to emphasize a couple of those numbers, the testing positivity rate is 6.8%, which is really a great improvement and shows that the passing of the virus around the community is much less now. The case rate is 18 per 100,000. And so that's significant because for us to get to the red tier, we have to be below 7 per 100,000. So we still have a ways to go, but we're a whole lot better than, I think we were at 60 per 100,000, not just a few weeks ago. So we've improved a lot. We still have a ways to go before we can get to the red tier. And also the other thing that number is important for is if we're under 25 per 100,000, and again, we're at 18, that the kindergarten through 6th grade classes are able to open up from the state point of view. So the schools have to have their plans ready and they have to be prepared to do it. But from the restrictions from the state point of view, K through 6 is able to open now, given the case rate we have now. The middle school and the high schools need to wait until we're in the red tier for at least 5 days. So I want to talk a little bit about the variants because that's something that's being talked about a lot. We are seeing variants in the state of California. There's a couple of them that are particularly concerning. The B.1.1.7, that's the one from the United Kingdom. That's been seen in Southern California. Also, just recently, just yesterday, they identified 2 cases of the South African variant, which is called the B1351. And that one's, so both of those are kind of concerning. If you see what's happening in South Africa and in London right now, it's moving fast. It seems like they have a higher danger, higher level of danger, higher level of risk. And so they seem to be present in the state now. We don't know how much, but it's something to be very aware of. There is another variant that we're seeing. They're calling it the California variant, or B1427. And this is one that has been identified in Lake County. We don't know really what the clinical significance of that is. We don't know if it's more contagious or if it's more dangerous than the other ones, but we have seen it up here now. And so all of this is basically means that we need to continue to be cautious, even though things are getting better, and we need to really work on getting these vaccines out as soon as we can to try to get as many people vaccinated as possible before these variants get a really solid foothold. So let's talk about the vaccine. Like Sarah said, we've got over 10% of the population's vaccinated now in Lake County. We're really excited about that. The teachers and the school staff and the people that are in the phase 1A, which is mainly healthcare workers, have all been offered vaccines at this point. If you're in one of these tiers and you didn't get vaccinated for some reason, or we missed you for some reason and you want to get vaccinated, you're able to write to us at the MOAC email line, and we'll try to reach out to you and get you an appointment. But as far as we know, we've offered those to everybody now, and we're moving on. So at this point, we're focusing on the elders and the mainly the older folks right now. We are moving forward as quickly as possible. The supply chain is really the main issue here. We're getting about 1,000 doses a week, something like that, and we're getting those out as fast as we can. So they're by the end of the week, or by the time we get our next shipment, they're pretty much all gone. We are moving through. We were getting a fair amount coming in through Sutter and Adventist, but and so those folks have been vaccinating a lot of people as well. Those numbers that Sarah mentioned earlier do include the ones through Sutter and Adventist, but I think they've been having a little bit of trouble with their supply chain now as well. So we're just, as much vaccine as we can get in the county, we are trying to get it in and get it out to people as soon as we can. You may see in the news that the federal government is starting to make some arrangements with some of the pharmacies, CVS and Rite Aid in particular, to get vaccine out in the community. At this point, none of those in Lake County are participating in that. They are going to be in some of the neighboring counties, and you can go on the websites and see that people are able to go out of county to those sites. So if you're having trouble accessing an appointment in Lake County and you want to try to go that way, that's another way to do it. The other thing is they just put up a large stand-up site in Oakland now, and that's going to be doing a couple thousand people a day or something like that. So that's another place to try to get it if you want to get it fast and you're having trouble getting access to it in Lake County. So we are, just to kind of update people about what's happening right now, we are getting ready to change the sites. Up until now, they've been indoors, and tomorrow and Saturday, we're still going to have the same site in Clear Lake that's indoors. But then starting next week, we're going to change our whole model to a drive-through model. This is going to be a little tricky, but because we're getting a little bit more vaccine and because we're starting to have a lot of the second doses, the second shots, our numbers are getting real high and it's getting too crowded in the building. So we're moving to a drive-through model. With the weather today, that's going to be a little bit of a challenge, but I think it's going to be better in the long run because we're going to be able to accommodate a lot more people, and we're hoping that we're going to be getting more vaccine as the weeks go by. So the drive-through will be Monday and Tuesday in Lakeport starting next week, and Thursday and Friday in Clear Lake. So the days are changing and the sites are changing a little bit. So especially for, if you're getting an appointment for your first dose, it'll be clear what to do. But folks that are getting their second doses, it may be a little bit confusing because some of the days are different and some of the sites are different. For the second doses, we should be calling you. You should be getting a call from somebody to confirm the time and date and location. But if for some reason we're not able to get through to you or you're not getting the call, feel free to email us at the MOAC site and we'll try to get you or whatever. But just know that the site may be a little bit different and the day may be a little bit different than it was originally planned when you got your first dose, just because of some of these changes. So it's the appointments are what's really got people's attention right now. Again, we only have 1,000 a week, and we have something like 50,000 people that are 18 and above. So it's going to take a while to get through the tiers that we have. The appointments now are available to the public. So if you go to our website at the Lake County Health Department, there's going to be links that are on there that you can get for the next couple days. They fill up fast. There's not that many. And once they fill, they fill. We're only opening a few days at a time. We have to wait and make sure that our supply of vaccine gets in before we can open the appointments up. Because if the supply doesn't arrive, then we're going to have to cancel all these hundreds of people, and people are going to be pretty upset. So we're kind of waiting. We do a couple days at a time. People can go on the website and find the links and go online and make their appointment. If the appointments fill up, they fill up, and then you just have to wait till the next days open up. For folks that are unable to access the computer, so either you don't have internet access or you're somebody who just isn't comfortable on the computer and you don't have anybody to help you, there is a phone number you can call, and that's 993-4644. So that's especially for the older folks, to call that number, and they can help you get on. They can help you make the application for the appointment online. They don't have any extra appointments, so don't call them if the appointments are filled up on the online portal. It's only for the folks that just don't have access on the computer. If you need information, call 211. That's the best place to get information now about this. We're updating that regularly, and that'll get us some. If you have more specific questions that 211 won't help with, you can call 263-8174. That's what we call our MOAC line. So that's where you have any kind of COVID questions, you can call that. Or you can email us at MOAC, MHOAC, at lakecountyca.gov. That's the line for that you can email questions. And we have people there from 8 to 5 every day, and we should be able to get the answers for you. So these are some of the ways to get information. To keep you up to date, because things are changing so fast, and all the different recommendations are changing all the time. We are having some staffing needs around the drive-through sites. We've been very fortunate to have a lot of community members helping us with the vaccine sites so far, with the testing sites before, and now with the vaccine sites. So folks are, when you go into one of these sites, probably half the people are just volunteers from the community. So we're really appreciative of all the help. And I think people ought to be really proud that their neighbors are stepping up to make sure that they can get these vaccines out to people. To get this many thousands of vaccines out with our small staff is really because people are stepping up to help us. We do could use some clinical help, some people that are clinical folks that are able to give vaccines. We have this medical reserve corps, and so we're going to reach out to some of the people that have signed up for that we haven't reached out to yet. But if you are a medical person, maybe a retired person or a pharmacist or a dentist, those are all people that can give vaccine now. You can sign up on the medical reserve corps, or you can contact us at the health department, and Dean is the person to ask for there. So if you're wanting to help out and be part of this big effort to get the vaccine out, we would welcome you in. So the tiers are part of this whole discussion. Since we have such a limited supply, we're having to prioritize certain people to get them to the front of the line, because each week we just can't vaccinate everybody that should be vaccinated. We have completed the 1A, so the healthcare workers, the people in the nursing homes, the staff in the nursing homes. We've completed the teachers in the school staff. We're working on the elder group, the 65 and over, and so those are the folks that are the main priority right now. If you're 65 and over, you are eligible to get the vaccine, and you're the folks that should be signing up on this line or calling the number that I gave. There's no need to call the senior centers anymore. They were helping us quite a bit to contact the more vulnerable seniors that were on their list, but they're not doing that anymore. We've taken that a different way now so they can get back to their normal work. They were pretty overwhelmed with the phone calls and with everything they were having to do. We really appreciate them helping us, because I feel like we were able to really target some of the folks that really needed the vaccine the most, and now we're opening it up to the broader 65-year-old and older community. But there's something else we need to talk about, though, because part of the deal with the vaccine distribution is we're really trying to have a health equity focus. We're trying to really address the parts of the community that have not gotten, that are affected by the virus more heavily than other parts of the community. And what we found when we've looked at the data in the past, and what still seems to be true, is that the Latino community and the Native American community are getting about 2 times the number of infections that the Caucasian community is getting. And there's probably a lot of reasons for that, but part of it is they're out in the community working and maybe living in multi-generational households and things like that. So we are trying to make sure that we can get the vaccine out into that community as quickly as possible. And so one of the things we're starting to do now is open it up to the farm worker community. We have some slots in the stand-up vaccine clinics that are going to be reserved for the farm worker community, and we're trying to work through the growers and the agricultural organizations to help us bring those folks in. We're probably also going to start doing some mobile vaccine clinics in the near future to go out to the workplaces to do that. So, there's a good public health rationale behind this. We're trying to protect the people that are most likely to get sick and protect the people that are most likely to die. That's been part of the focus with the elder folks, but there's also in the Latino and the Native American communities, there's an increased risk of getting the infection and getting real sick and dying. Tribal Health is doing a really good job of getting the vaccine out into the Native community, but the Latino community is one that we really are trying to focus on to get the vaccine out to them. So, I think that's probably all about that one. So the last thing I want to just kind of mention is we have started this ethics committee. It's this is part of a group that's helping advise me about ways to think about prioritization, and if there's any kind of special needs in the community that we need to address. I get a lot of pressure every day of different people and different groups in the community that want to make sure that I'm aware of the needs of their people and the maybe the perceived increased risk of them because of work or different things, and definitely understand that. And in my opinion, I really wish everybody could be vaccinated that wanted to be. That's really what the goal here is. The problem is this shortage of supply and just not having enough vaccine to work with. So we're having to put some people in the line in front of others. And it's very, very frustrating. And, some of the decisions are probably frustrating for everybody to watch because they see somebody in front of them in line and they don't understand why that is. So this ethics committee is one of the ways to try to make sure kind of that we're thinking about it properly and not missing out on things. They met this week, a couple days ago, and seems to be a really good group that's going to be helping us quite a bit on this. There's a press release going out today that's going to go into some detail about that. But also, if people want to register an opinion about something that should be happening with the vaccine distribution and prioritization, that's one way to get your opinion to get noted. You can send in an email to the Mohawk line no more than 200 words, please, and let us know which group you're representing and what your thoughts are. But we'll collect these and then we'll present those to the group, and they can review these and see if there's patterns going or if there's anything in particular that we're missing that we need to think about. So that's one access point for people to influence and get your voice heard about the need for the vaccine prioritization. So just in conclusion, things are going well. Things are looking a lot better in terms of the case rate and in terms of the illness in the community. And we are getting the vaccine rolling out. Over 10% of the community now is vaccinated. And I look forward to getting to that 60-70% range when things are really settling down and we're getting some real benefit from it. I think one of the things that came out yesterday from the Center for Disease Control in Atlanta is the thinking that maybe people ought to really focus on masking even more than before because of these variants, and kind of upgrade your mask a little bit. So when you put the mask on, make sure it's tight around your face. And there's a lot of interest and sort of evidence starting to come out now of the value of double masking. So maybe wearing a surgical mask, the paper surgical mask close to your face, and then putting a cloth mask on top of that. It seems like if you do both of those, the decrease of transmission is quite high. So it's probably worth thinking about that when you're going out into public now with these variants floating around. So all in all, thank you everybody for your cooperation and for paying attention out there and taking care and to try to prevent the spread to your neighbors and your family. So thank you.